From Rural Doc, Alan Lindeman. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic is going to be really interesting. It's the topic is going to be, as I'm going through, the topic is aspirin during pregnancy. Is it safe to take aspirin during pregnancy?
Well, Neil, there's a lot of mileage on that question, and no matter where you go, the answer is yes and no. So the yes part is low dose aspirin is safe throughout pregnancy. The no part is, well, you can use higher dose aspirin up until about 19 weeks.
What does the Mayo Clinic consider to be a low dose or a safe dose of aspirin during pregnancy?
Well, we call that the baby aspirin or that little orange tasting aspirin. It's the 81 milligram dose, and that is considered to be safe for the entire pregnancy.
When might your doctor recommend the use of a low dose aspirin during pregnancy?
Well, certain health conditions, the aspirin is very useful for, including blood clotting. That is, if you clot too much, preeclampsia, if you've had several miscarriages or other pregnancy loss, sometimes kidney disease, diabetes, or high blood pressure.
What are the risks by trimester of taking higher doses of aspirin during pregnancy?
Well, in the first trimester, it's associated with pregnancy loss and birth defects. In the second trimester, you could have kidney problems, low amniotic fluid, and the FDA recommends against high-dose aspirin, ibuprofen, Advil, Motrin, naproxen, Aleve after 19 weeks of pregnancy. And for the third trimester, um, any of these used for long periods of time during pregnancy can increase the risk of brain bleeds in preterm babies.
Is there a risk to mother of taking a low dose aspirin daily?
Well, there is a little bit of a risk, Neil, and that is you could develop a stomach ulcer, you could have bleeding ulcers or other GI bleeding, and certainly if you have a history of an ulcer, if you have or you know you have GI bleeding, then don't take the aspirin or at least talk with your doctor about it first.
If you were going to take a low dose aspirin during pregnancy, when should you start?
Well, ideally, it's before 16 weeks, but there's a time window on it, and that's between 12 and 28 weeks.
Why do doctors prescribe aspirin during vitro fertilization, IVF?
Yeah, well, in vitro, this is used as an anti-inflammatory, and it's also used for platelet inhibition. In other words, so that you don't have platelet clotting. And it has the ability to dilate blood vessels, and that is useful for implantation. So it is felt by most people in the in vitro, the IVF community, that low dose aspirin improves pregnancy success rates.
What are the most common side effects of taking aspirin during pregnancy?
Well, it would be stomach aches and more bruising than usual.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys. Take care.